My name is Esa Hämäläinen. I'm the medical doctor and emeritus professor in clinical chemistry. I'm coming from the University of Eastern Finland. Well, if we are talking about the mass spectrometry, so we consider the sensitivity and specificity. And there are several groups of patients which have to be measured, or their steroids hormones have to be measured with mass spectrometry. I would say that especially if we're talking about testosterone, for example, so the children and female patients have very low levels of testosterone, and I think that we have enough data and publications showing that immune chemistry cannot measure reliable the low levels of those patients. So I would say that mass spectrometry is the method of choice for measuring, for example, testosterone. However, many laboratories are also using the immune chemistry for male patients because they think that it's working nicely with higher levels of testosterone. But there's a problem also because the main use of testosterone for males is the hypogonadism. It means that we are measuring the lower levels of testosterone. And if we consider the level of 5 to 8, for example, nanomoles per liter, so there is a significant variation of testosterone results if we measure it with immune chemistry. So I would prefer the mass spectrometry also for male samples. So the so-called reflex testing may be usable for some cases, but if we want to be sure that we are measuring the right things, so I think the mass spectrometry is the method of choice. Well, I think it's very, very crucial in every case, and because I have been studying steroids and doing research for almost a little bit more than 40 years. So in the clinical cases, I would prefer the best method for patients, and I give some samples of clinical examples of cases where there are the very high sensitivity is needed. For example, if we are measuring the estradiol in postmenopausal women when the ovarial function has decreased and the normal level is quite low. If they got, for example, the breast cancer and we are treating them with anti-estrogens, anti-aromatase therapy, so the level is decreasing even more. And if we want to see the response to the therapy, so we should have very sensitive analysis for estradiol. The immune chemistry is very usable for measuring large amount of steroid hormones. That's why we are using it for cortisol, because we are not capable of doing all the cortisol analysis with mass spectrometry. So for practical reasons we use it. But if the new fully automated analyzers come, so I think the certain patients, especially those who have low levels of cortisol, they can be measured more reliable with mass spectrometry. if the clinicians know that they can get a good and reliable result with mass spectrometry within nice turnaround time. So I think they could ask more freely the hormone analysis, steroid analysis with mass spectrometry. But I think the other is that we can get a free capacity from our mass spectrometers, which are dedicated for steroid analysis. If we do them with fully automated systems and have a small turnaround time and use them for more complicated analysis. We can have a much more clearer picture of the metabolism, and we have examples that we may have metabolites that are physiologically active in addition to this parent compound. So it may give much more better diagnosis or confirm our diagnosis. I would say that the future is very interesting in this field also.